The University Health Network preparing for cold and flu season with a new masking policy for not just patients, visitors and staff as well. Let's bring in CP24's Kayla Williams live in studio to break it down. Kayla.
Yeah, that's right, Andrew. Starting in a week's time on Monday, October 28th, the new masking policy will be in place across the University Health Network system and all of its hospitals and sites. And with more on this story, I want to bring in Dr. Susy Hota, the head of infectious disease at UHN. Thank you for your time, Dr. Hota. And so walk us through the timing of this new masking policy, of course, ahead of flu and cold season.
Right, so this will all begin in a week from today, so that's October 28th. And we really wanted to be ahead of the curve in terms of when we expect respiratory viruses to really be taking off. And looking at what the trends were like last year, for example, we really noticed a lot more respiratory virus activity with COVID-19, influenza, and RSV, which is another common respiratory virus. The middle of November is really when it started to take off. So this is one more measure that we can add within hospitals to try and enhance our infection prevention, for respiratory viruses.
Mm-hmm. And I mean, this shouldn't come as too much of a surprise to whether it be patients or staff or those visiting the hospital, trying to be as preventative as possible. What are we looking for as far as a timeline on this? Are we going to keep this in place for essentially heading into the winter season, and maybe we'll decide to move things or scale things back by the springtime?
That's exactly it. So we do want to ensure we have enhanced coverage and enhanced masking at least through our peak period. We anticipate, again, looking at what we see in previous years, that by the end of February, the respiratory viruses should be coming down a little bit in terms of, the prevalence. And so we will be looking at the trends over time, reevaluating when would be an appropriate time. But the idea would be to be turning this on and off, so to speak, as an enhanced measure to protect our patients and our staff and visitors, et cetera, through the peak respiratory virus seasons.
Mm-hmm. And I know you noted that typically it really starts to rev up in the November month, but how are we looking as far as a city goes when it comes to cold and flu virus season and the amount of cases that we're seeing so far in the month of October?
So right now, we're still seeing a lot of the common respiratory viruses, like what we call rhinovirus. It causes a common cold. That is circulating for sure. We're also seeing moderate levels of COVID-19. It's come down a little bit in the last week or two, but certainly pretty stable at a moderate level. Mm-hmm. We're not seeing influenza viruses at any appreciable amount yet, and that usually does take a little longer to pick up. And we're expecting we'll see a little bit more respiratory syncytial virus or RSV soon. So we are seeing a steady, low to moderate level of respiratory viruses in the hospital system, in healthcare at the moment, and of course within the community. But things are manageable right now. And this is our time for action to do the prevention that we have control over, like masking and vaccinating, et cetera.
Mm-hmm, certainly. Okay, so we know that this comes into effect, I should say, a week from today, Monday, October 28th. Is there anything else that our viewers or anyone who will be, using any hospitals or sites within the UHN umbrella should know?
First of all, I think it's important to recognize other hospitals in the area are also doing this. We all feel the same way about this strategy, and it's very much in keeping with what the province would recommend and what, the Canadian Public Health Agency of Canada recommends. But really important messages for everybody. This is just one strategy to reduce respiratory viruses and the impacts on your life. So getting vaccinated, we have influenza vaccine, updated COVID-19 vaccines, RSV vaccines for some, as well as staying home when you're sick is really important, especially when you're going to be going into hospitals and there are lots of vulnerable people around.
Okay, we appreciate your time this afternoon. Dr. Hota, head of infectious diseases at UHN. Thank you.
Thank you.